Hey, I'm Dr. Lonnie Green, Medical Director at Ravi Aesthetics. You can find me on Instagram at Ninja Injector.
I'm Jade Ramadan. I'm a physician associate at Ravi. I've been in practice for about 6 years. I specialize in doing lip fillers, but I do the whole array of different areas like beautifications, cheeks, chins, jawlines, everything you can think of. And you can follow me on Instagram at Jade Ramadan _PAC. And I also have a TikTok with the same exact handle. Today we're talking about fillers.
Fillers are substances we use to replace lost volume in our face.
So filler, for the most part, is hyaluronic acid gel, which your body contains. Your body has lots of hyaluronic acid in it, so it's recognized as something natural.
Fillers are a wonderful tool that, if used correctly, can restore volume, enhance beauty, and really bring back some youthfulness in a natural way.
So a typical filler appointment for a Ravi guest is very different than most other places. I've worked in a lot of different offices. We really focus on the patient experience.
When you come in for a filler appointment, the absolute most crucial thing is to find out what is on your mind, because we want to address your concerns and make you look sort of to your vision, but in a very natural way.
So I really emphasize that consult portion of the appointment. We give you a good 15 to 20 minutes of numbing prior to your filler.
As a surgeon, I clean with two different kind of things because I really love a clean field. And then I will make sure the patient's comfortable. I have a neck pillow, we've got a small squeezy ball, we've got a little vibrating tool. We want to make this as comfortable as possible and take away as much stress as possible.
Then we do the procedure. I always like to joke that the procedure takes the least amount of time out of the entire appointment. It's quick, it's easy, I make it as painless as possible, but at the same time, I like to take my time and make sure I'm delivering the best possible result.
And the filler is done, then they look in the mirror, and usually that's my favorite part.
Photos are taken before and after, and those are added to your chart so you can kind of see the difference, which is super cool. The charts are accessible to patients through the TouchMD app.
And then we give them instructions, and then I follow up with them the next day by text, and we check things out.
Pre-care for filler, differs per area, but across the board, we tell people no blood thinners. Another pre-care instruction is no makeup.
So I give my patients pretty explicit aftercare instructions. Basically, for about 48 hours, I don't want them to do cardiovascular exercise where they're going to do an aerobic workout. Walking and things like that is fine.
For post-care, I tell my patients just expect bleeding and bruising and swelling. With the lips, for example, they're definitely gonna swell. They will most likely have some form of bruising. Cheeks, jawlines, smile lines, areas like that have less of a risk, but it is always a risk. So for post-care, I tell people, number one, do not plan major events within 2 weeks of your appointment. I know that some people don't bruise and they're unicorns, but it doesn't mean that you're gonna be one of them. Don't plan like hot date night or like a wedding or traveling within 2 weeks of your filler.
It's really important that patients avoid dental procedures for a few weeks after the filler and that they don't get vaccines. The dental procedures can put bacteria into your bloodstream, and there's an increased risk of the filler getting infected. Vaccines make your immune system go on hyper alert, and sometimes our immune system can recognize the filler as non-self and cause a little swelling. It's never permanent, but it's best to avoid those things.
So this is arnica gel. Again, any health food store, Whole Foods, Trader Joe's, Publix, CVS, put it in your fridge after filler, put it on the areas when you think about it. It is cold, it feels great, it helps with swelling and bruising. It's the best thing in the world. I have like 3 tubes in my fridge at home.
A lot of people ask me about sleeping. It is best, I tell them after filler, I say, it is best now and for the rest of your life to sleep on your back, and you won't be wishing your face. However, I don't want my patients to stress out about that. No one has ever ruined their filler because of the way they slept.
Okay, questions I get frequently asked about filler. Number one is the freaking pain level. Look, like needles in the face, not super fun, but I will tell you, I have never in 6 years had someone who could not finish a procedure. It's never ever happened. We do things like numbing the patient. There's lidocaine in all of the fillers that we use. These things help you get through this session. I would say nobody tells me it's worse than a 5 or 6 out of 10 tops.
A lot of times patients will be wondering, how long does filler last? And honestly, the answer depends on a couple of things. The firmness of the filler, what part of the face we're putting it in, whether you move a lot. If I had to generalize, I'd say around, anywhere from 1 to 2 years, and there's a range depending on what part of the face.
Am I gonna look fake? And like, I know it's kind of hard. You're walking around downtown, you're seeing all these people that look like the Real Housewives of Richmond, and like, they look like that, and then you have like significant others like, I don't want you to look crazy. There's this massive stigma with fillers and Botox. It's getting a little bit better. Fillers should optimize your anatomy as it is, make it a little bit more beautiful, but it should not alter you, warp you, make you look like a different person if done correctly.
My favorite thing about filler is the aha moment. I mean, it's just so pleasurable to hand the patient a mirror and see that look on their face when they just see what they had envisioned. It's just, it's what I live for, you know? It's so much fun. It's such a great honor and pleasure to be able to do this. Every day I wake up just so grateful to be doing this, and I can't even believe how lucky I am.
I love the reaction that people give me when they see it. So the backstory, long and short of it is, I was much younger than I am now, and I got my first filler. And when I looked in the mirror, I remember crying. I remember thinking I couldn't look at myself before this filler. I had such low self-esteem, and I felt so infinitely better, so grateful for the injector, so happy that she was there for me. And so that reaction, when my patients feel the same way, I feel that again every day. And I show patients all the time, and I see crying, and I see gratefulness, and I see new confidence almost immediately. So that flash of happiness and confidence is my favorite thing about filler. It's immediate, it's highlighting your natural, beautiful features. I'm a non-committal person, so it's nice that it's dissolvable. Not that I've ever had to do that, but it's, for me, the reaction more than anything else.